Good morning and welcome to News for Hearing Impaired. I'm Shubhendu with my colleague Meera Bhatia. Let's begin with the headlines. Union Home Ministry writes to all states and union territories to ensure compliance of the Supreme Court directions on welfare of migrant labourers housed at relief shelters. Availability of essential commodities under control as several ministries work in coordination with state governments to resolve logistical problems. Union Health Minister Vardhan held a review with Council of Scientific and Industrial Research through video conference about the steps undertaken by CSIR and its constituent 38 labs towards mitigation of coronavirus outbreak in the country, says CSIR scientists to develop COVID-19 mitigation solutions, keeping fixed time frame in mind. Active COVID-19 cases across India rise to 7,409 with 273 fatalities and 764 recoveries. Government focuses on increasing testing facilities, says no need to panic as government is planning things so as to effectively manage the situation. Number of hotspots in Delhi goes up to 43 with a few more localities added as containment zones. High-risk zones and containment zones to be sanitized from today in the national capital. COVID-19 cases across the world continue to spiral up. Over 18,45,000 cases registered globally with over 1,14,000 deaths. US President Trump signs presidential disaster declaration for all 50 states in wake of COVID-19, while the US records 1,514 virus deaths in past 24 hours. UK Prime Minister Boris Johnson discharged from hospital. India's response to contain COVID-19 has been proactive and the government has followed a graded approach. Focusing on increasing testing facilities, the government has said that there is no need to panic as proper planning is being done effectively to manage the situation. Further, in coordination with the states, the centre is ensuring supply of PPE, N95 masks, testing kits and ventilators. Besides, dedicated COVID hospitals are also being set up to provide proper treatment. The figure of active cases has risen to 7,409 with 273 fatalities and 764 people discharged so far. In view of the Supreme Court's directions regarding welfare of migrant labourers housed at relief shelters and camps in different parts of the country, Union Ministry of Home Affairs has written to all states, union territories to take necessary action in compliance to the directions of the court while implementing lockdown measures to fight COVID-19 effectively. The court directed that adequate medical facilities besides proper arrangements for food, clean drinking water and sanitation be ensured for migrant workers at relief camps, shelters across the country. Further, trained counsellors and or community group leaders belonging to all faiths should visit the relief camps, shelter homes and deal with any consternation that migrants might be going through. The court also observed that anxiety and fear of the migrants should be understood by the police and other authorities and that they should deal with the migrants in a humane manner. Union Health Minister Dr. Vardhan yesterday held a review meeting with the Director General of Council for Scientific and Industrial Research, Shekhar Mande, and all the 38 CSIR lab directors. During the meeting, Health Minister exhorted scientists to develop COVID-19 mitigation solutions, keeping a fixed time frame in mind. He added that these are times of war and we need to deliver solutions before the war ends by not treating this as a routine research project. Dr. Vardhan said genetic sequencing was crucial in eradicating polio and it will help in COVID-19 mitigation as well. During the meeting, CSIR DG said a core strategy group has been set up and 5 verticals have been identified under which coronavirus-related activities are being carried out. These include digital and molecular surveillance, rapid and economical diagnostics, new drugs, repurposing of drugs and associated production processes, hospital assistive devices and PPEs, the supply chain and logistics support systems as well. Dr. Mande also mentioned that 15 CSIR labs are working in close partnership with major industries, PSUs, MSMEs and other departments and ministries at the time of crisis in the country. The Health Minister appreciated that CSIR labs were also conducting tests of swab samples of coronavirus patients. Some of them have started doing genetic sequences of the virus with the target of doing 500 sequencing in the coming weeks. He also appreciated the work done by CSIR NAL with BHEL and BEL on ventilators, oxygen enrichment devices, and also developing 3D printed face shields, face masks, gowns and other protective equipment, adding that all these things will help us in the next few weeks. Meanwhile, in the daily briefing, Health Ministry and Union Home Ministry shared the updates for Sunday. Ministry of Home Affairs Joint Secretary Punyasalya Srivastav said the government is working with the states to ensure door-to-door delivery of essential commodities. She said that curfew passes are being issued for suppliers of essential goods. She said Cyber Dost, a portal to tackle cybercrime, especially financial crime, has been launched since there is an increase in online financial transactions. Health Ministry Joint Secretary Love Agarwal said that 80% cases are mild and asymptomatic and are treated at COVID care centers. 1,05,000 beds are available for COVID patients and number of hospitals and isolation beds are increasing every day. 500 beds dedicated at Safdarjung for COVID-19, 444 additional ventilators being provided in Andhra Pradesh, 1,200 beds dedicated hospital in Ahmedabad. Private hospitals like Apollo and Max Hospital have also made arrangements for patients. Meanwhile, ICMR said that work on developing vaccine is underway and 40+ candidate vaccines are under development. And similar to phase 1, where 5,000 coaches of railways had been transformed into isolation wards, in phase 2, 20,000 train coaches will be transformed into isolation wards. Delhi government has identified 3 more areas as containment zones in the national capital. The number of containment zones in Delhi now stands at 43. Southeast Delhi, highest number with 12 containment zones. East Delhi has 9 coronavirus containment zones, followed by Shahadra at 5 and West Delhi at 4 containment zones, while South, Southwest and Central Delhi have 3 containment zones each. New Delhi and North District each have 2 such zones. Mahavir Enclave is amongst the latest neighborhood to be declared as a containment zone. The total coronavirus cases in Delhi has risen to 1,069 according to the latest data from Ministry of Health. 19 people have died in the state so far from coronavirus, while 25 have been cured or discharged. Delhi government has announced several containment zones in the national capital. Operation Shield is being implemented in these areas. This exercise is being expanded to cover more areas based on the need. High-risk zones and containment zones will be sanitized from Monday using high-tech Japanese machines. Delhi police has appealed to people to cooperate with authorities by staying home on two upcoming festivals of Baisakhi and Ambedkar Jayanti.
कि जो आने वाले दो फेस्टिवल हैं, एक वैसाखी है और एक अम्बेडकर जयंती है, इसमें तमाम जो लोग हैं वो घर में ही रहें और बाहर ना निकलें और लॉकडाउन को इम्प्लीमेंट करने में दिल्ली पुलिस का सहयोग करें जैसे आप पहले सहयोग कर रहे हैं। मैं आशा करता हूं कि आपका सहयोग हमें मिलेगा। इस लॉकडाउन के दौरान किसी भी सोशल रिलीजियस फंक्शन की सख्त मनाही है और इन दोनों फंक्शंस के लिए बैसाखी और अम्बेडकर जयंती ये आप घर में ही रहें, बाहर ना निकलें और दिल्ली पुलिस का लॉकडाउन को इम्प्लीमेंट करने में सहयोग करें।
Union Minister for HRD, Shri Ramesh Pokhriyal Nishank, has launched a web portal, Yukti, or Young India Combating COVID with Knowledge, Technology and Innovation today. It's a unique portal and dashboard to monitor and record the efforts and initiatives of Ministry of Human Resource Development. The portal will cover various initiatives and efforts of the institutions in academics, research, especially related to COVID, social initiatives by institutions and measures taken for betterment of the total well-being of students. It will also facilitate various institutions to share their strategies for various challenges that there are because of the unprecedented situation of COVID-19 and other future initiatives.
मंत्रालय ने एक युक्ति पोर्टल तैयार किया है। ये युक्ति पोर्टल ऐसा प्लेटफॉर्म होगा जिसमें हमारी सभी संस्थाएं, चाहे हमारी आईटी है, एनआईटी है, आईसर है, आईपीएस है, मानव संसाधन विकास मंत्रालय से तमाम जुड़ी छोटी बड़ी संस्थाएं हैं, वो क्या क्या काम कर रही हैं और वो क्या क्या अभी तक उन्होंने अनुसंधान किया है, वो सभी इकट्ठा एक स्थान पर होगा। और वर्तमान परिस्थितियां जब पूरी दुनिया कोरोना वायरस के इस महामारी से जूझ रही है, इस संकट से उबरने के लिए ये तमाम संस्थान क्या शोध कर रहे हैं, क्या अनुसंधान इन्होंने अभी तक किया है, वो सभी जो उनके प्रयास हैं वो प्रयास एक स्थान पर प्राप्त होंगे।
India has gifted 5 lakh tablets of HydroxyChloroquine to Afghanistan to fight COVID-19. 251 containers carrying the first consignment of 5,022 metric tons of wheat out of the total gift of 75,000 metric tons were sent to Chabahar Port from Kandla Port on Sunday. The remaining consignments will follow in the weeks ahead. The number of coronavirus cases continue to rise across the world. Over 18.45 lakh people have been infected across the world due to it. The death toll has crossed the 1.14 lakh mark with over 20,000 deaths. United States has the highest number of fatalities, followed by Italy, Spain, France and the United Kingdom. The data is undoubtedly grim, but it cannot be overlooked that more than 4 lakh people have recovered from the disease. Over 26 lakh people have been tested globally so far. 3 distinct strains of COVID-19 have been identified by Dr. Peter Foster, a geneticist at University of Cambridge, and his team. They traced the origins of the pandemic by analyzing some 160 genomes from human patients. The team found that the strain in Wuhan, the hardest hit city in China, mutated from an earlier version.
Mutates, it changes, and you get variants arising, and which is the original one. You find out that a location in the network, which we call type A, is the original type that would have infected humans. Then it mutated and changed into a type B. This type B was then the first genome to be picked up in Wuhan when the disease became apparent, and that is mutated further into C. Now the C type is not found in the early phase of the outbreak in China. It is found outside. For example, it's well represented in Singapore.
The United States, which became the outbreak's latest epicenter after China and Italy, eclipsed the total number of cases in Italy and Spain as the country confirmed cases reached 5,56,044 patients and deaths surpassed 21,300 as it records 1,514 virus deaths in the past 24 hours. US President Donald Trump has declared a national emergency and all the 50 states have been notified with major disaster declaration, as more than 95% of the country's 330 million population are under stay-at-home order. Meanwhile, as US church leaders peppered their Easter gatherings amid coronavirus, people took part in masses which were held online, on television and even in parking lots, to people sheltering in cars to maintain social distancing during the pandemic. As governors and health authorities across the United States have broadly asked residents to avoid gathering in large numbers. Italy on Sunday reported its lowest coronavirus death toll in more than 3 weeks. The 431 new deaths reported by Civil Protection Service were the lowest since March 19th. Italy's death total now stands at 19,899, second behind the United States. According to officials, the number of people currently showing COVID-19 symptoms is still growing and has reached 1,02,253. However, number of people receiving emergency care has dropped. The number of people in non-critical hospital care has also seen a significant decline. Italy was the first Western democracy to be hit by the virus, and its lockdown has now been extended until the beginning of May. Police officers in Spain's Madrid paid tribute to health workers by playing music for them outside a hospital in a moment of relief from coronavirus emergency. Health workers happily danced and clapped, holding flowers and signs after almost a month of lockdown in Spain. However, Spain's coronavirus death toll rose for the first time in 3 days on Sunday. A total of 619 people died over the past 24 hours, bringing the cumulative toll to 17,209. Confirmed cases increased by around 2.6% to 1,66,831. Tough lockdown measures have helped to bring down a spiraling death rate that reached its peak in early April. Meanwhile, all non-essential workers had been told to stay at home, but government plans to revert less strict curbs that were in force up to March 27th. In United Kingdom, the death toll from COVID-19 rises to 10,612 across hospitals in the country after it recorded a daily rise of 737. The total number of infection cases has reached to 85,206. British Prime Minister Boris Johnson was discharged from hospital earlier. Johnson was taken to St Thomas's Hospital in London on April 5th. He was moved into the intensive care unit the following day and remained there until April 9th. In France, the number of people who have died from the new coronavirus infection rose to 14,412. Meanwhile, the infection has risen to 1,33,670, as cited by the Health Ministry. Speaking at a news conference, French Public Health Chief Jérôme Salomon said the number of hospital fatalities rose significantly, although the number of people in the intensive care units fell to 6,883, 121 less than 7,004, marking the third straight day that the figure has dropped slightly. The death toll in France from coronavirus outbreak rose at a slightly slower pace, suggesting that the lockdown was producing first effects. Rio de Janeiro statue of Christ the Redeemer was lit up on Easter Sunday with images of medical workers in honor of all those fighting the COVID-19 pandemic around the world. The giant statue of Jesus Christ that stands nearly 100 feet tall and overlooks the city of Rio de Janeiro was also visible, Christ wearing doctor's uniform. Nepal has reported 3 new cases of coronavirus. With this, the total number of cases has gone up to 12 in the Himalayan nation. Ministry of Health and Population spokesperson said that condition of all 3 patients were normal and are undergoing treatment in Birganj. He also informed that 5,184 tests have been conducted in the country so far, including 795 samples tested in the last 24 hours. Spokespersons added that 7,973 persons have been kept in quarantine throughout the country, while 85 persons are in isolation. Prime Minister Sheikh Hasina of Bangladesh announced a 5,000 crore taka special subsidized loan package for boosting agricultural production in the aftermath of corona crisis. Prime Minister Hasina said that the refinancing scheme of 5,000 crore taka will carry a maximum interest rate of 5%. She said that small and medium farmers will get the loan from this fund to use as current capital for use in agriculture and related activities. She also announced an additional 9,000 crore taka for fertilizer subsidy in the next budget to minimize the impact of corona pandemic on agriculture in Bangladesh. Earlier on April 5th, the government of Bangladesh had announced a subsidized loan package of 72,750 crore taka for various other sectors of the economy. UAE government has announced 387 new cases of COVID-19. According to the Ministry of Health and Prevention, the total number of cases in UAE now stands at 4,123. UAE government also announced recovery of 92 new cases after receiving necessary treatment, taking the total number of recovered to 680. The Health Ministry also revealed 2 new deaths taking place, taking the total number of casualties to 22. The government said that they will review labor relations with countries not responding to evacuation requests of private sector expats after coronavirus outbreak. Meanwhile, Saudi Arabia has confirmed 429 new coronavirus cases over the past 24 hours, bringing the total to 4,262. An additional 7 deaths were recorded, bringing the death toll to 59 as of Sunday. After Indian security forces eliminated 5 terrorists on the line of control and 4 terrorists in hinterland in last week, Pakistan Army resorted to ceasefire violations in Kupwara sector, the response to which was befittingly given by the armed forces deployed in the area, in which Pakistan Army and terrorists suffered numerous casualties. Yesterday, in a brazen, unprofessional and unethical act, Pakistan Army initiated unprovoked artillery fire targeting innocent civilian population, especially the poor Gujjar villages where there are no presence of armed forces installation or deployment. This has resulted in deaths of 3 innocent civilians, including a woman and a child. Indian Army has vowed suitable retribution to this reprehensible act. British motor racing legend Sir Stirling Moss has died at the age of 19 following prolonged illness. He is widely regarded as one of greatest Formula One drivers of all times. Even though he did not win the World Championship, he retired from top-level competition after a crash in 1962. He won an astonishing 16 Grand Prix in 1950s and early 60s, 4 times championship runner-up, and also 3rd overall on 3 occasions. No other driver has won as many races without taking the title. Stirling Moss, recognized as one of the greatest drivers, he was also the first British to win his home Grand Prix, beating Fangio at Liverpool's Elm-Tree circuit for Mercedes in the year 1955. And with that, we conclude this bulletin. Take good care of yourself. Namaskar.